Hello and welcome. My name is James Martinez. I'm the admissions counselor for the University of Houston College of Pharmacy, and I want to thank you all for tuning in today. Joining me today is Dr. Asias-Dinh, and she's one of the speakers that we are highlighting in our Why UHCOP series. And this is a series that includes faculty, students, recent graduates on why they chose the University of Houston College of Pharmacy. So if you would, Dr. Asias-Dinh, please introduce yourself.
Hi, thank you, James Martinez. So I'm Bernadette Asias-Dinh. I'm a faculty member at the University of Houston College of Pharmacy, as you mentioned. I'm actually also an alum of the program, but I'm going to be talking mainly as a perspective as a faculty member today. So I went to pharmacy school at the University of Houston College of Pharmacy, like I mentioned. And after pharmacy school, I ended up doing a residency in Central Texas at the VA, and that's in Temple, Texas. And after that, I actually ended up working in an area of pharmacy called ambulatory care pharmacy. And this area of pharmacy is outpatient. And I have, in my past few jobs, have had a collaborative practice agreement where I can actually independently adjust drug therapy for patients who have chronic diseases like diabetes, high blood pressure, high cholesterol. I can help them quit smoking and also manage some blood thinners. And that's also what I do here at the college as part of my job, is that I have a practice site where I'm able to provide these services, and I'm able to bring students on rotation with me there.
Yeah, and can you talk a little, there's really two things I want to touch on here. Can you talk a little bit about why you chose pharmacy and specifically ambulatory care?
Sure, yes. So I think why I chose pharmacy to begin with is because whenever I was in high school, I was one of those nerds that was in those health science clubs. And I was fortunate enough to be able to shadow different areas, different healthcare professions. And every time I came across pharmacy, I felt like their role was almost like a quality control, making sure that if medications were prescribed, they were prescribed appropriately. If they were given appropriately, you know, when working with nurses and working with physicians. And so I think that kind of intrigued me. And the second was how accessible pharmacists were to everybody. I forget what the percentage is, but almost the majority of Americans live within a mile of a pharmacist or 2 miles of a pharmacist, something like that. And I think just being able to build relationships with people on the outpatient side really drew me to pharmacy, just that opportunity. So kind of the piece of, I get to kind of double check, make sure one of those last checks before something goes out to a patient to make sure it's safe, but also being able to work within my community and make an impact. So it was the initial interest in pharmacy. And I felt like once I got into pharmacy school, my mind was blown because there's so many different areas of pharmacy you can really get into. And what really excited me about ambulatory care pharmacy is that it is on the outpatient side, which I really realized I gravitate more towards the outpatient side because these patients, you're really meant to build that long-term relationship that I kept talking about. And we're talking about patients who have had some problems with their medications or problems with getting to goal with their disease states. And so I get to spend one-on-one time with them to, I guess, turn things around and help them get better and dig deeper as to what is going on, what are the barriers. And so when I learned that there was this opportunity, it just really struck a passion in me because I felt like, for each individual patient, as long as I help them get better, I really made an impact in their life. And everybody says it, they get in this to help people. And, I felt like this was the way that I wanted to help and the most impact that I could see myself giving for a patient. So that's what drew me into the ambulatory care side as well.
Yeah, and that's awesome. And you talk a lot about how you got into ambulatory care and the impact that you wanted to have on your community. Now, there's a lot of pharmacy programs to choose from in the state of Texas. What was it about UHCOP that worked for you?
That's a good question. I think, UHCOP I'd say the first thing is location. Being in Houston, the Texas Medical Center is in our back door. And so when you have so many hospitals, such a big system kind of competing against each other, you can say, they're also pushing each other and pushing our profession forward, pushing medicine forward. And so I feel like a lot of the care that we provide in Houston can be more progressive than other places. And, I did mention I did my residency outside of Houston. And so I could see the difference. So that's like one major part, is that your colleagues, your network here, the level of care, the level of knowledge is high. And so if I were, being a student also in Houston, when I was in pharmacy school, I felt like you could tap into all these people that are just kind of movers and shakers in medicine. And I say the second is the diversity. And I'm not talking just, definitely ethnic backgrounds, but also just diversity in people's life situations, whether they're people who are fortunate enough to have a lot of money and those who are homeless. There's opportunities for students to care for both sides of the spectrum and everything in between. And I think learning how to help people who have different circumstances and situations is so valuable and keeps you better, well-rounded to manage any kind of patient that you may be servicing in the future. So I'd say location is probably one of the big things because of the advanced medicine that we practice here in Houston, and then the diversity of the people, because it helps you service a wider range of people or be prepared to service a wider range of people in the future.
Yeah, and I really enjoy what you said about diversity of the student population, but also the population of people that you'll be serving as a pharmacist. That goes a really long way. A little earlier, you mentioned student interactions. Can you talk a little bit about your interaction with students now, either through teaching or through any other avenues for you?
Yeah, sure. And I am one of the lucky ones because I get to see students pretty much on day, like super early on, maybe week 2 of their first year. And then I see them graduation or like their last rotation of their 4th year. And so I teach a lot in the communications realm and patient assessment realm. So it's kind of those practical pharmacist skills that we provide in the clinic setting. And then I also teach a lot of those diseases that I mentioned that I managed earlier, such as diabetes and high cholesterol. So I teach a lot of that in the 2nd year in the modules. And then I teach about this area of pharmacy, ambulatory care. And then during the 4th year, I'm lucky enough to work with students as they go on rotation with me and really get to know them at a different level, because we are with each other for so much time in that 6 weeks. And I get to see them not only where they've come from a P1, but even during that 6 weeks, like how much growth they have in comfort with speaking to patients, managing patients, talking to other healthcare providers. And so, yeah, those are the different places where you may see me in the program.
Awesome. Well, that's really cool. And like you said, you're working with students at the very beginning, and then also you get to see that growth over the course of the last 3 to 4 years as they get ready for graduation. The last thing I'll ask is, what advice do you have for pre-pharmacy students who want to pursue pharmacy?
That's a really good question. I feel like there could be so much said here, but I think one thing that I've seen or noticed is that when someone has an interest in pharmacy, of course, they go to whoever is closest to them who is in pharmacy, which makes sense. And you should do that, but don't put all your eggs in that basket, right? So I would recommend that you ask that person about how they like pharmacy, their pathway there, and their area of pharmacy, but also ask another person and just kind of build these people, a network of people that you can ask about the profession. Because even within one area of pharmacy, if you ask 3 pharmacists about their job, how they like it, What's their day-to-day? It's going to be totally different depending on where you are. And so I think if you reach out to more people, not only does that give you a wider look or a broader scope of the possibilities, but then you're already building your network, right? And these people can help guide you, hopefully to get into pharmacy school. And then when you're in pharmacy school, if you want to go into their area of practice, guide you through then as well. So I'd say if you're going to ask somebody for purposes of trying to figure out if you want to do pharmacy, don't just ask one person, ask multiple people, and then kind of take it from there.
That is honestly really good advice. I work with a lot of students as they're coming into the program or looking to begin, and they're like, well, I heard this from one person, this from another. So yes, get a variety of opinions and kind of take what you can from your experience as well as theirs and make it your own. All right. Well, I want to thank you all for joining us. I'm James Martinez, the admissions counselor for the University of Houston College of Pharmacy, and this was Dr. Asias-Dinh. Continue to follow along in our online initiatives. We'll have our contact information here in the description box as well as on your screen, and please reach out to us if you have any questions. Thank you.